Preeclampsia, or gestational hypertension, happens in about 1 out of every 25 pregnancies. Many women aren't aware of this condition or the risks that come along with it. WSAV's Sarah Smith brings us a story from a patient at St. Joseph's Candler who recently gave birth early after a visit to the ER.
Arlene Gutierrez had a pretty perfect first pregnancy.
I didn't really have symptoms. Besides back pain, I didn't really have any weird cravings or anything like that.
Until she hit 31 weeks. Gutierrez says her body just didn't feel right. She had a variety of symptoms, from swelling to a piercing migraine, but couldn't put her finger on what was wrong.
I called my doctor's office. I let them know. They said, hey, come in, we want to take a look at you. Everything came back normal.
But just 2 weeks later, Gutierrez was back at St. Joseph's Candler preparing to give birth via C-section to her baby girl at 33 weeks.
The doctor's office, who had made it home at that point, was back in my room. And she was like, okay, so we're gonna wheel you in right now. We're gonna do a C-section right now. This is getting really dangerous. I don't like what this is looking like.
The reason? Gutierrez had developed severe preeclampsia.
Preeclampsia is a condition only of pregnancy. We typically diagnose it after 20 weeks of pregnancy when patients have elevated blood pressures, as well as typically with protein in their urine.
If gone untreated, there could be severe complications for the mother and the baby.
Preeclampsia is caused by issues with formation with the placenta. And so the main way of management of preeclampsia, once we have reached certain thresholds, is delivery. After delivery, symptoms of preeclampsia tend to resolve on their own.
One of the things Dr. Loftus wanted to stress to women out there is it does not matter your age, race, or underlying conditions. Preeclampsia does not discriminate.
I don't have anybody in my family or any pre-existing blood pressure problems, so I just didn't think it would happen to me.
While her daughter spent 9 days in the NICU, both mom and baby are happy and healthy 8 months later.
She listened to her body, and we had an open communication throughout every single encounter.
Seek the medical help as soon as you feel any kind of, hey, this isn't right. Like, follow your instincts, listen to your body.
Sarah Smith, WSAV News 3, on your side.